pelvis and chest is very important, as they can be the source of hidden bleeding in a patient with shock. Here you can see a major crush injury. So very often we see a patient with lactate levels coming at 9. Once we adequately do it, every 4th hourly they repeat, 4 to 6 hourly they repeat. So as it goes, shows a downward trend that indicates your ongoing resuscitation is adequate.
Talk is always at a pretty high level, because right from training days in Tamil Nadu, I've seen for the last 30 years, they taught really well, so you can interact very nicely. So my brief today is how to avoid or treat complications in aesthetic breast surgery. Now, as we know, we have multiple procedures, but the 3 major procedures in aesthetic breast surgery will be, which we will discuss today, augmentation with implants, breast reduction, and mastopexy.
And if you see in this patient, the limb looks almost like a normal limb. And same Chinese, they also say like that. But it will take about, why some people from the beginning, it will be independent function.
And these are the 5 major hospitals where bulk of these works have been done. Straight line closure. In fact, even in Millard, when you close the mammalian straight, you get a better mammalian. I mean, we are able to assess the thickness better.
Asked to plan things 3-dimensionally, but the 4th factor was the time factor, because microvascular surgery was not yet developed in this part of the world.
This is very, very important. And please remember, each succeeding rhinoplasty effort will only give you diminishing result. These type of cases, you have to wait till the disease process is burnt out.
Good morning, everybody. Thank you, Srinivasan, for that wonderful introduction. And thank you, Dr. Karthi, for this wonderful conference along with your team. When you asked me to speak about the 4th dimension,
and all of us know, as TC put in his first slide, that all of us know what a 3D means. It means length, height, and depth. But then if you have these, these are all visible, it is measurable, and it is replicatable.
It has been great day yesterday, but today at the inaugural function, it is even more special to welcome all of you.
Good morning and welcome to all the delegates for TANPAPS 2024. It's indeed a great honor to introduce the chief guest, guest of honor, and the international guest. The chief guest today is, I hope I'm spelling it right.
Good morning, everyone. Dignitaries on the dais, our beloved senior Dr. Mukunda Reddy sir, Dr. GK, Dr. Hong, Dr. Jaykumar, Dr. Sridhar, Selva, Dr. Subhashini, and so many seniors in the audience whom I've always looked up to.
When I think about India, I think about 2 things. It's a great mix of nature and technology, and it proved me right this morning because the rooster started crying at 3 a.m., and I started to hear electronic dance music from 6 a.m. So I found myself in India.
on neonatal brachyreflexus palsy. Now this is an occasion I just cannot pass over lightly. Can I request all the authors to please come on stage? It is like seeing so many stars on the stage at one time.
Free flaps being done left and right in every center by everyone, every plastic surgeon.
It was in 1982 that I joined Stanley, and one of the morning meetings I walked in a little late.
Last but not the least, my sincere thanks goes to our event organizers.
A very good session with our international guest speaker JP Hong here. JP is a great friend, but then more than saying is a great friend, I should say is a great surgeon.
Only about saving lives. It's about giving a life of hope, giving a life that allows to be normal, that we take it for granted. But for the people who are out there, their dream is to become normal and have a normal life. And we, through innovation, allows us to give that to them. Innovators work hard, they persevere, they dedicate, and they're passionate.
I first call upon Professor C.N. Ramasamy to share his best results.
And also on the ulnar side of the palm, you can see the contracture. So if you release all the SSG area.
My further specialization in oculoplastic surgery made it possible for me to utilize this technique.
In Chennai 4 years back, and it's a 30-year-old young girl with such a huge leg, and many people advised her to go for an amputation. Then she was referred to me.
See, I follow this Daniel Broman classification, which is acceptable to Indian population, where the visceral volume is the mainstay. If it is indications for it are only going to exponentially increase. This is my disclaimer. I have no financial interest in any of the instruments or machines which are going to be shown in this particular talk. Now, well, what is autologous fat grafting? It is obviously the utilization of one's own fat harvested from one site and injected into a recipient site elsewhere.
I first call upon Professor C.N. Ramasamy to share his best results.
And also on the ulnar side of the palm, you can see the contracture. So if you release all the SSG area.
My further specialization in oculoplastic surgery made it possible for me to utilize this technique.
In Chennai 4 years back, and it's a 30-year-old young girl with such a huge leg, and many people advised her to go for an amputation. Then she was referred to me.
See, I follow this Daniel Broman classification, which is acceptable to Indian population, where the visceral volume is the mainstay. If it is indications for it are only going to exponentially increase. This is my disclaimer. I have no financial interest in any of the instruments or machines which are going to be shown in this particular talk. Now, well, what is autologous fat grafting? It is obviously the utilization of one's own fat harvested from one site and injected into a recipient site elsewhere.
Wounds happen as a result of trauma or after trauma. Uncared or improper treatment of acute wounds are the commonest cause for problem wounds.
So wounds that don't progress through the healing process in a timely fashion, that's how we define problem wounds. They can be of various causes, mostly infection, arterial insufficiency. The DCLTI foot, basically there is a wound healing failure. It is a failure of the fibro-capillary network, which is called the organ of the repair. And why it fails? It's because of the combination of macroangiopathy and microangiopathy.
Once thought to be an old age disease is now seen commoner in young adults. It poses personal, professional and social issues. And as reconstructive surgeons, we have a bounden duty to offer them a permanent cure.
The concept of perforator and perforator-based flaps was initially proposed and described by Koshima and colleagues in the late 1980s, which marked an era for reconstructive surgery.
Good afternoon, everybody. So I'll be talking about flap monitoring by tissue oximetry. So in yesterday's master class, it was actually mentioned that most senior surgeons do not find the need.
As I move further, I will be navigating about the complexities and challenges in burn surgery in acute phase and a short overview of reconstructive surgery in burns. As in initial management, initial phase starts with
post-traumatic raw area with islanded RSSA flap and ear keloids, complex ear keloids treated with minimal deformity, temporoparietal fascia flap for post-traumatic ear defect, abdominoplasty.
I'll be talking on flap-in-flap technique for fingertip management. Fingertip injury with distal amputation is one of the common hand injury problem. Though multiple options are available, the conventional Atosoi or neurovascular VVA flap is one of the commonest flap which helps to cover
these problems, but usually these are not discussed in the formal teachings. Now the purpose of me making this presentation is to impress upon my colleagues who would like to start the hair transplant practice that it is as important.
So it is depicted as a balance with two boxes. In one side it is a work, the other side it's a life. What is work? Work is as a surgeon, we are operating, going for the clinic, paperwork, administrative duties, teaching, presentation, coming to the conference.
Now, leadership from a plastic surgeon's perspective. So Gillies principles always hold good in our plastic surgery, surgery in our day-to-day life and also in our day-to-day life.
So I did my MBBS from Thrissur Medical College, went on to do diploma in orthopedics from Trivandrum Medical College, moved to the US where I did general surgery residency in Columbia University.
And work-life balance we saw earlier. And this is a very interesting question where we asked whether you will encourage your daughter to take your line of work. At that time, only 32% told yes, definite yes. So 2 by 3 is not.
When I took up plastic surgery, I thought that it was going to be a easy life for me. I don't have to get up in the middle of the night, etc. But unfortunately, it turned out to be the other way.
So that is the beauty of cooperating and coordinating and working as a team. So I thank all of you for being here with us this evening and giving the opportunity, and the men who have been kind enough to be here and enjoy our session.
Good evening, respected chairpersons and my dear colleagues and respected professors and friends. So my topic on facial bone fractures, our experience in KMC is mainly to highlight for the audience.
Also with multiple hyperpigment patches all over the body. Negative history of trauma, family history or neurological deficit. There's a massive tumor. The patient was disturbed and had to leave the studies.
OMFS fractures were 123 and total number of patients with mandibular fractures were found to be 81 and incidence rate of oromaxillofacial fractures were 9.8%, whereas the incidence rate of...
So first and second patient I didn't think much, but third patient really made me to think about we should study
regarding the psychological morbidity. So I thought we will do this study. So luckily, we had data on psychological morbidity.
Introduction. Facial injuries comprises about 13% of in the emergency department. More than 50% lacerations are treated at the emergency department itself. Aim of the study is to study the epidemiology of facial soft tissue injury, the pattern of involvement of facial aesthetic.
Background. Forehead flap refers to pedicle flaps of skin and subcutaneous tissue that are harvested from the forehead region. Historically, they have been in use. There are records been found since the time of Sushruta and even in the 10th and 15th centuries.
Raman, regarding pedicle anterolateral thigh flap, how far it can reach and...
Because we don't want, because usually in the stretch position, this will be little tightness will be there.
Seniors and my friends, good evening to all. I am going to share our experience of using vaccinator myomucosal flap.
Good evening, everyone. Today's my topic is reconstruction of the composite defects in the anterolateral abdominal wall with pedicled anterolateral thigh flap and its modifications. Coming to the introduction.
Good evening, all. I am presenting a clinical study of functional and aesthetic outcomes of fingertip reconstruction with the local regional flaps and grafting in a tertiary care center. Fingertip injuries.
Good evening, everyone. I am going to present about the motorcycle chain sprocket injuries of the hand, the patterns, classification, and their management. So, hand injuries causes a major morbidity and have a severe impact on the economy.
Good evening, everyone. I am going to present a paper on subungual clomos tumor of finger, unveiling the painful journey. Introduction. The glomus tumors are benign vascular hematomas.
So pariromal disease is characterized by progressive soft tissue and bone atrophy on one hemiface and results in an aesthetically unpleasing appearance and functional impairment which affects the patient psychologically and socially.
Facial trauma in women is complex with physical and psychosocial and cultural influences impacting the clinical presentation. Although multifactorial assaults and falls are principally reported as the main causes, motor vehicle accidents.
Good evening all. Myself Dr. Krishnamurthy. I am final year postgraduate from Mother Medical College. Restoring identity of a person in mangled faces, our initial experience.
Analysis of incidence and management of palatal fistula in a tertiary care hospital over a period of 10 years.
One and all. My paper is on an analysis of post-traumatic ear reconstruction, the challenges encountered and aesthetic outcomes. So, reconstruction of a post-traumatic ear defect, especially in adults, is a challenging undertaking and